Hello. So what effect are HIV programs having in Africa? This is just a very quick guide. Now there are various HIV interventions being delivered currently in East, Central, Southern and West Africa. So what effect are they having? Here we consider just four main interventions. Antiretroviral therapy to treat people living with HIV, which also acts to prevent onward transmission, including to babies of pregnant and breastfeeding women. Secondly, use of antiretroviral drugs in people without HIV to prevent HIV acquisition. This is pre-exposure prophylaxis or PrEP. Voluntary medical male circumcision, VMMC, to reduce risk of HIV acquisition, and making condoms freely available in public places. So we have used a well-established simulation model called HIV synthesis to estimate what would the effects of stopping some of these interventions be, and you can see more details on that link. So these simulations are done over a range of setting scenarios across the region, not for one specific country. They broadly represent patterns seen in the region as a whole. The point to note from the graphs on the following slides are the relative changes in numbers of outcomes, such as new infections and deaths, not the absolute numbers. So the shape of this curve illustrates the progress to date on HIV-related deaths in Africa in people aged 15 plus. And this slide illustrates the progress to date in incidence of new HIV infections in adults in Africa. And finally, this illustrates the progress to date in new transmissions to babies in Africa. That's either during pregnancy, childbirth, or breastfeeding. Now, to illustrate the effects interventions are currently having, we consider effects over 10 years to 2035 of removing interventions in 2025. And you can see here which interventions are variously being removed. So this slide shows the trend in the number of HIV-related deaths, as shown earlier. This slide then shows that we can see the impact of removing the various interventions on HIV-related deaths. This graph shows the trend in incidence of new infections, as shown earlier. And now we can see the impact of removing the various interventions on HIV incidence. And finally, this graph shows the number of new transmissions to babies, as seen earlier. And this shows the impact of removing the various interventions on the number of new transmissions to babies. So this was just a quick guide to illustrate what effect HIV programs are having in Africa. And this final additional slide just shows the effects on PrEP, VMMC, and levels of condom and sex that were modeled for each of these scenarios.